testing elbow flexion, right? Manual muscle testing, you wanna start at the beginning of the range, okay? So if you put them on the plinth, be aware, one end or the other end, never in the middle. Because when you're in the middle, unless you have extremely short arms here, you're already gonna be starting somewhere in the middle of the range, okay? Alright, so be aware, so that's what, these chairs are gonna be here, okay? These chairs are gonna be here for you to use, okay? Be aware, when you guys start flipping your partner around for different things to do, remember your rights and your lefts, okay? Remember that, because it can get confusing. I get confused. I do this all the time, figuring out which is right, which is left. Alrighty, so against gravity, elbow flexion. Can you do me a favor and just turn the chair that way? By the way, is that good? No.
Safety issues.
Yeah, she should have a shoe, but we're saving time right now. We're trying to save time right now. Because what's gonna happen, if she's really weak, she'll slide because she's gonna use a lot of force to resist me. She's not gonna have that tension, alright, in her, that tension in her foot to help resist me because she has socks on, okay? So be aware of that, okay? What if she was sitting on the plinth? What may she do to try to improve her elbow flexion, right, if I'm resisting her? She might lean forward, okay? She might try to bend her knees into more flexion a little bit. So you wanna be aware of these kind of little things that your patients will be doing when you're testing strength, okay? Alrighty, when they lean forward, you're gonna notice that. Tell her, don't lean forward, okay? If she is crossing her knees to try to tighten up everything, put a stool on top of her or a chair, not on top of her, but on top, under her feet, okay? Under her feet, so she doesn't do any of that stuff, okay? Alrighty, use whatever things you have. And remember, Mr. Mitchell and I have everything around you. Take a look where everything is. If the sheet's covering the table, look underneath the sheet, alright? Things like that just happen. Okay, so for elbow flexion, what I'm gonna ask her to do, can you just palm out like this? Can you, keeping your back straight, don't lean back too much, okay, but keeping your back straight, can you bring your elbow, bend your elbow for me by bringing your hands up? Alright, good, very good, bring it back down. So I know she can go against gravity now, right? That muscle was the bicep brachii, yes or no?
Yes.
Okay, alright, so I wanna really see how strong she is, okay? So I'm gonna support her back. I don't want her leaning, because what do people tend to do when they lean back against a chair?
Compensate.
They compensate, don't start sliding forward, shortening their trunk muscles, okay? So what you want her to do is sit up straight. I'm gonna have one hand here, sort of keep an eye on everything. I'm gonna use my elbow to do this, okay? Alright, so I'm gonna, can you do it one more time? Then, and I see her biceps coming in, alright? Her biceps coming in. Now, I know her biceps are working, so maybe I'll move my stabilization a little bit more up here, alrighty? I have my hand up here, my forearm is pretty much at the ready. If she starts pushing back, right, I'm gonna resist, just right below the elbow, alrighty? I don't wanna be on the insertion, so I'm gonna be somewhere in the middle, alrighty? So, keep your back straight, look ahead. I want you to do the same thing again. I'm just gonna apply a little resistance to you, alright? Whatever you give me, I'm gonna try to give back to you, okay? So on the count of 3, 1, 2, 3, go, 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 go. And I'm probably gonna stop, probably like around 90-ish, 100 degrees. Because at that point, am I still going against gravity?
No.
For elbow flexion? No. Okay? So you're gonna stop at one point. So I'm gonna, while my hand is here, I'm gonna be able to feel if she's bringing in her anterior deltoid, her coracobrachialis, because I'm gonna see some movement going on, right? Is she leaning her back against my hand? Okay, so she's drawing in some trunk muscles now, coming into play. Whatever they wanna do with their hand. Whatever they wanna do with their hand, okay? I don't tell them to make a fist or anything like that. Whatever they do. If they start making a fist and they start curling in their wrist flexors also, then I'm gonna tell them not to do that, okay? Because at that point, what are they trying to do? Because what can your wrist flexor mass up here sort of do? Help with the elbow flexion. So if I see that coming in, I'm gonna tell them, oh, don't do that. All right, try to relax your fingers a little bit more, okay? Right, if they hold their fist and they're not doing anything else with it, I'm not gonna really care that much. It's because I'm gonna be seeing what everything else she does, okay? And so if I wanted to try to facilitate her, okay, she's in the position of her brachioradialis, her thumb is out like that now, right? So I'm gonna have, okay, can you bend your elbow again? Okay, and you can see it coming into play. Yes or no? Alrighty, alrighty. If I want to palpate the muscle, now, I'm gonna have my hands right here. Alright, use my fingertips because it's it's a skinny muscle, but it's a thick muscle. So I'm just gonna spread my fingers out a little bit. Can you do that same motion? Right in there, I feel it. Right now, if I really want to resist her motion now against gravity now, right? Remember, it inserts pretty much down by the lower quarter of your radius, right? So I don't want to be too close to here like I was for the biceps. I'm going to be a little bit more distal, and most likely I'm going to use pretty much, alright? I'm going to just use my fingertips instead of my whole hand like that because I don't want to interfere with it. Alright, so I'm going to put my hand here. I stabilize her shoulder area. I feel using my forearm to help. I already palpated it. I'm going to add some resistance on the count of 3. Bring it up. 1, 2, 3. Go, 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 go. Ooh, and she's strong. Okay? And she's strong. So I'm going to feel that. Feel resist here and see what she's able to do. Okay? Yes or no? For her brachialis, go pronate your arm. Okay? Alrighty. Same thing. Can you bring your top of your hand towards your shoulder again? Very good. Bring it back down. Alright. Can't really palpate for the brachialis here. Alright, so what I'm gonna do, place my hand right in the middle again. Alright, on the count of 3, I want you to do the same motion. 1, 2, 3. Go, 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 go. Ooh, and she's strong. Alrighty. So you're gonna, this is the manner that you want to try to facilitate the individual muscles. Yes or no? Okay. Gravity eliminated. What position would I have her in?
Sideline.
You could do sideline. Okay. Alrighty. So if she was sideline, come. Is that what I wrote in the book, by the way? Sideline. Sitting. You could do sideline. Okay. I could show you both. Okay. So if she was sideline, what would it exactly look like?
You'd be sitting on her non-affected.
Yeah, she's on her non-affected side. She's on her non-affected side, and she's basically it's just like shoulder flexion, like we did for the hip and the knee. Alrighty, right? If I wanted to do it in a sitting position, what would I have her do? You think?
AB duct.
AB duct. Okay, so now what's important about the abduction part, though? I have to she has to be strong enough to hold it up there, or I'm gonna have to support it. Alright, so that's why sometimes we do use the sideline position. So she's here, stand. Okay? Go into, right? Okay? Alright, so I'm holding it, okay? She's pretty much in a abducted, fully extended position. Can you turn your palm up? Thank you. Alrighty. Okay, are you uncomfortable?
No.
You sure? How's the shoulder?
It's fine.
Okay, alrighty. So if her shoulder's not bothering her, because I am abducting her, and if she's supinated, right, some people may have that greater tubercle sort of hitting onto the acromion process already. If it's really bothering her, I would just go into more full external rotation, okay? Alrighty. If it's not bothering her, just leave it, alrighty? Because at this point, I don't want it to cause damage here. Because what else is getting possibly impinged? Possibly. Yeah, no, not really. Nerves on, because they're down here in the axilla. Your biceps tendon, okay? So you're going to be judging, okay, and adjusting how much rotation she's in depending on if she feels any impingement. She good? Are you good? Okay. Drop it in my hand as best as you can. Okay? She's holding, okay? Now what I want you to do, okay, can you just sort of bring your fingers towards your shoulders a little bit? Okay, and what'd she just do? What is this position? Is this against gravity or gravity eliminated?
This is against and then it goes with.
Yes. Okay, so she still went against gravity because I'm just holding her arm in abduction, which is fine because, again, what's that going to tell me I need to do?
Test her against gravity.
Test her against gravity or facilitate my words, use my words a little bit differently, right? Because I just said, bring your fingers towards your shoulder, and this is what she did. And then she did do it. And I said, because I told her wrong. So you got to be aware of how you're telling your patient. And you know what? That's okay, right? Because you're going to be adjusting everything, right? Your communication skills depending on what type of patient, okay? And a lot of times, so you tell your patient, okay, do this now, right? And you just say, okay, thank you. Now let's try it this way now, okay? Alrighty. So can you just sort of bring your hand across your chest, but keep your just your elbow hard, okay? Alright. And I'm gonna see what she does, okay? And bring it back. Alrighty. I want to palpate the muscle now to make sure, because if she is gravity eliminated, she's going to have difficulty with it. Alrighty. So I'm cradling her. Alrighty. Alright. So can you do that same motion again? Alright. And I'm just going to go along with her and back. What else am I doing right now? Well, I'm not really helping. I'm supporting. Palpating. I'm palpating the muscle. But what other thing am I doing right now also? Bring it across. Alright, and bring it back.
Flexors of the wrist?
No, I'm doing more of extension at the wrist also. I mean extensors at the elbow.
Oh.
Right, because this is the same position you would do for elbow extension. Alright, but what position am I starting in?
Extension.
Alright, extension for flexion, and for testing flexion, and flexion for testing extension. Okay? And you're going to be switching your position. Because remember, when you're in the clinic, alrighty, motions like these, okay, elbow flexion extension, internal or external rotation, no matter what joint you're doing, you're going to be doing it in one swift arc of movement, alrighty? And you're not going to be isolating any of these movements, are we? You guys are isolating it more for the fact it's whatever chord you happen to be picking up, okay? Alright, so if I want to test for elbow extension, she starts in this position. I'm gonna palpate, okay? Can you straighten out your arm for me, okay? And I'm gonna see if it's working or not. Alrighty, and if it is, bring it back. Can you just do it one more time for me? Alright, what may she try to do to sort of compensate a little bit? Put your arm down. Shoulder.
Abduction, horizontal abduction.
Yeah, she might try to do some shoulder horizontal abduction. What else may she try to do? If a person is that weak.
Trunk, turn her trunk.
Yeah, she might turn her trunk a little bit. Alrighty. She might do some abduction, regular abduction a little bit, just to get that motion going. Alright? So think about if they are, remember, gravity eliminating. Patients still want to impress you with everything. They're going to try to do anything to sort of compensate. Yes or no?